Front moves through, and it's back to the upper 50s by midweek of next week. Back to you.
All right, thanks so much. It is 8:19. Now, don't you hate it when your significant other looks at you and says, is it that time of the month? Okay, because you know they're not talking about, are you paying the bills this time of the month? You know what they mean. The emotional roller coasters, the moods you get in. It's PMS. It's estimated that up to 75% of women will get it at some point in their lifetime. And if so many of us have it, what do you do about it? Is there something to cure it? Joining us this morning is Dr. Sonnie Kim-Ashchi. She is an OBGYN at Women's Special Care, and her patient, Cheryl Plogger. Good morning to the two of you.
Thank you for having us.
Cheryl, you have PMS?
Yes.
Every month on the clock or no?
No, not every month. You know, every month is different. My symptoms are different every month. So some
what
months,
symptoms do you
some
have?
months I'll have some months I'll have headaches and fatigue, irritability, obviously. So it just depends on the month. Sometimes it's more severe than others. Definitely cravings, salty foods, sweet foods, chocolate.
Oh, yeah.
So,
Dr. Kim-Ashchi, what is PMS? Is it a hormone issue? What is it?
Well, PMS stands for the premenstrual syndrome. So it usually happens right after the ovulation, like 2 weeks after the first day of your cycle, and then it gets better once the menstrual flow starts. So it can be emotional, it can be physical. Emotional, as Cheryl said, it can be irritability, anxiety, sadness, and depression too. Physically, you can sleep a lot, or insomnia, or acne, or the breast tenderness and bloating around the waistline areas. So that's the symptom.
Is anybody more predisposed to getting PMS than
Not really,
others?
but it's very, very common. About 85% of the reproductive age women suffer from this one way or the other, emotional or physical.
And it's diagnosed symptomatically, right? There's no blood
correct.
test to diagnose it.
I mean, we do the blood test to rule out other things that kind of mimic the PMS, like a hypothyroidism or irritable bowel syndrome or depression, but there's no lab test to diagnose the PMS. As I said, just right after the ovulation, 2 weeks after the first day of your cycle, and it gets better once the menstrual flow starts.
Okay, so Cheryl, does it get better for you at a certain time?
it does, but it just depends on the month, because some months it's worse than others. So after, like she said, it does normally go away.
Does your significant other complain to you about it as well? I mean,
Yes, sometimes.
Sometimes. My husband will say to me, and I'm like, you know what? Don't even go there. All right. So, Dr. Kim-Ashchi, you have brought some things that help some women with PMS.
Sure. We always recommend the diet, and also not diet to lose weight, but the diet to avoid like alcohol or caffeine or high salt food or the refined sugar. And we always ask also the patient to take some kind of exercise class to use endorphin from our own body to feel good about ourselves.
That's over here. We're talking about yoga or exercise in some way.
And then, some people get better with the vitamin E or vitamin D or calcium, magnesium supplementation. And especially for the people who have a lot of bloating sensation, you can use this one too, Pamperin or the PMS Diurex made by the Midol.
We've run out of time, but I quickly want to address these over here. What are these?
Those are this is a birth control pills to kind of manage the hormonal fluctuation that might contribute to the PMS symptoms. And also we can use the antidepressant to deal with the emotional aspect of the PMS.
Okay, so if you're suffering from PMS and you just think, maybe I should go see a doctor, here are some tips and here are some advice on what you should be asking and some of the treatments for it as well. Dr. Sonnie Kim-Ashchi, thank you for being with us. And Cheryl Plogger, thank you for sharing something that's pretty intimate for someone else to share, right? Well, everyone's wallets are tight right now.